what is one piece of wisdom, whether from a mentor, a patient, or your own life, that has truly reset the way that you think about health and longevity?
I would say this is the greatest invention that's ever been created, even more important than TikTok and your iPhones. And you got to take really good care of it.
We're old for longer than we're young, and I'm going down fighting. And I thought that was so brilliant because it's true, right? What do we consider young? Under 25, the most of your life is when you are middle-aged and older. It's what you really need to invest in. That's the prime of your life. And that.
Welcome back to the Primal Reset podcast. Today, we're joined by Dr. Stuart Diamond, medical director and co-creator of Equilux, a telehealth platform unlocking personalized hormone health. With over 30 years as a board-certified urologist, he's pioneered minimally invasive surgery, led national conversations on hormone therapy safety, and is now bringing accessible, data-driven longevity care to patients everywhere. We're also introducing his wife, Noelle Diamond, who is a registered dietitian, an international speaker, longevity expert, clinical leader, and before co-founding Equilux, she's also founded NDA Medical Spa, the region's first luxury medical spa. At Equilux, Noelle blends her expertise in nutrition, clinical wellness, and patient-centered innovation to create a truly elevated experience. Stuart and Noelle, it is a pleasure to have you. Welcome to the show.
Thank you. We're glad to be here.
So I'm going to start with you, Stuart. Share a quick 30 to 60 second overview about your background, and then Noelle, I'll ask you right after.
Sure. So I'm originally from New York, and I did my residency and training in urology and oncology at Memorial Sloan Kettering Cancer in New York City. And for the first 8 years of my career, I was in academic medicine. What that means is I was teaching residents, doing research, training fellows. During that time, I got involved in laparoscopic or minimally invasive surgical procedures. So I've continued doing minimally invasive procedures throughout my career, even here at NDA and Equilux. Noelle and I have been married for 16. Noelle was a registered dietitian and a former Olympic level ice dancer. And we met at a small community hospital after I left my academic career in 2005. And for years, we talked about doing something together, all different kinds of businesses, especially in healthcare, because obviously we have two different perspectives on where we come from in healthcare. Obviously, beauty and fashion and longevity. And I'm not that. I'm the opposite of all that. But now she's transformed me into that. I'm like her Frankenstein that she's molded into someone incredible. And she is willing to do that, not just for her husband, but for everyone. But for years, we talked about doing something, and Noelle came up with the idea of starting NDA Medical Spa, abbreviated for Noelle Diamond Aesthetics, but also NDA, where you can trust us, your secret's safe with us. Not that anyone should be secretive about what they're doing. They should be proud of what they're doing. And we talked about doing something. 3.5 years ago, she came up with this brainchild to do NDA and joined forces together. I still do my traditional urology practice, and then her brilliant idea was for me to focus more on men and women's sexual wellness and health, where I do some special sexual procedures, something called the O shot for women. I'll do something called the P shot. I actually do a specialty procedure called the Diamond XL, which is a penile enlargement procedure using fillers, much like the fillers in your face. And then Noelle really had me dive into female hormone imbalance, which is where kind of Equilux kind of was an offshoot of NDA. And I'm going to have Noelle talk to you more about her journey to get to NDA and Equilux and shed more light on all that and her incredible background as a dietitian, thought leader, mom, wife, and daughter.
I mean, I think you kind of covered it. I don't know what else I can say about myself. You covered me so well
I think
there.
You got some more to go, girl.
Yes. So as mentioned, I started out as a figure skater, an ice dancer specifically. And during that time, I would always be very focused on not only nutrition for performance, but also nutrition for weight control. Unfortunately, it's something I battled with my entire life. And when it came time to go to college, I trained at the University of Delaware as a figure skater, and I stayed there for college. And when I was thinking about what major, I thought, well, nutrition's going to be easy because I already been dieting and know everything. But I knew a lot to know that it was interesting to me and how could have so many practical implications. So that's what I studied. And yes, I worked in clinical first, and then I have a very strong entrepreneurial spirit. So I started something called the Diamond Dish, which was nutrition counseling to people. But I always did feel it was a little limiting a lot of times because I would be so excited about my knowledge. I would counsel patients and I would tell them everything they needed to know in the first couple of sessions. And they'd be like, okay, great, well, bye. So as I was thinking about other business ideas, I was always very passionate about aesthetics. And I really saw the potential in it to helping people from the inside out. And then I saw a need in the community also for a medical spa that had a holistic offering, right? Not only nutrition and filler and Botox, we do body contouring, we do IVs, we do facials, and also in a warm and relaxing atmosphere that feels like a spa. It doesn't feel clinical and it doesn't feel medical. So people come in and sometimes people just want to come hang out with us. So that's the kind of environment that I wanted.
That's free of charge, man.
Yes, yes. And then at the spa, do a lot with peptides. I do a lot with weight loss. We do GLPs. We also do a host of other IVs, vitamin supplementation. And then a lot of women, my own age and older, were coming to me saying, there's something wrong. I can feel it. I don't feel my best. I've never had a weight problem before. And the weight would bring them in. But then we would dive in and feel and really recognize the fact that what they were really lacking as well was hormones. And there was a gender bias for a long time with the studies and the clinical data supporting that decrease of testosterone and estrogen in women starting at 35. So I started optimizing myself at 39. I'm 41. And we were so passionate about this advancement and being able to offer it to women and men, but because the women would go to their primary care, they would go to their OBGYN and they would say, am I crazy? I feel awful. And they would say, yeah, no, that's normal. It's typical. It's women your age, it's men your age. And then you would just have to endure and there isn't anything you can do. So from that need, seeing that need as we were speaking at conferences and the importance of the female hormones. And at that time, we were strictly pelleting everyone. And we spoke at a conference and the support was overwhelming and everyone was so excited. They would say, hey, can I get 40 of my friends together and you fly down and pellet all of us? And I said to Stu, well, we can't fly around the world pelleting everyone. So what are we going to do? So from that, we created Equilux to make it accessible for everyone to get this type of care that's really life-changing.
A true power couple. I mean, it's
It's funny, we weren't not looking for this. And as, Noelle said, we were in Miami just this past year, speaking at an organization called Innocos, which is run by this woman named Irina Kremen.
So INNOCOS,
Yes.
and follow them and subscribe to them on LinkedIn. They have wonderful papers
Yes.
and speakers, really like the thought leaders of the entire world. We were just in Geneva, like you said, Miami. They're having one coming up in Dubai. It's incredible, that community. So you should definitely join them.
It was, I was speaking there on female sexual function and hormone. And before the meeting, while we're there in Miami, this is in February, so it's a biohacking longevity conference. So people thinking out of the box. But while we were there, we were talking to women some of them were presenters, some of them were attendees, and they had no idea that they had hormones.
Or that they had testosterone in particular.
And a lot of them were like, well, I went through menopause. My grandmother, my mom, I'm going to go through it. And I literally started my talk after hearing these people before I spoke about how many people know that they have estrogen. And these are people who are in this longevity biohacking world. You would think people who know this, and none of them knew any of this. And I literally said the following statement. I said, that's great that you guys are taking algae pills and you're out of the box, but let's jump back in the box for a hot minute and talk about your hormones. And as Noelle said, everyone came up to us. And we were not looking for this. We were just kind of diving into this because obviously there's a lot for men out there. And I've been treating men for low hormonal imbalance for years. But we literally went away right after that and we were on vacation and we were like, I think this is something we have to do. And then we did a deep dive and then we could talk to you more about how we came up with Equilux and what makes it unique compared to other providers and some of the unique things that we offer. But it was literally in February, 7 months ago where this launched. We were both in Lisbon in June, speaking to female founders about what we're doing. And Noelle just spoke in Geneva just 2 weeks ago and in New York right after that. So this has only been our baby's only been born for 7 months, but we are ready to get it up, walking and talking and spreading the good word for females, because we all have women in our lives. You obviously have a mother and a sister or a daughter. And what's happened is most women are told this is normal part of aging, but for men, it's not. So men, we can do whatever we want, but for women, it's okay.
And for a woman, unless you are an athlete, a celebrity, actress, a singer, most of us are hitting the pinnacle of our careers, whatever it is, in our 40s, right? It takes that long to get there. And that's when your hormones are starting to decline. And that's when you're getting brain fog and fatigue. It's a horrible joke on all of us, right? And we're like, this is unbelievable. Something has to be done. Because that's the time when you need to be functioning at your highest, not when you're, partying in your early 20s. It's when you're really actually running families and companies in your 40s and 50s that it really matters.
Oh, yeah. I mean, and Noel's touching a little bit on some of the subjective issues, but then objectively, it's heart prevention, prevents Alzheimer's, bone disease, bone fractures, the collagen in your face, in your arteries, in the vagina. So it's a huge issue. So we approach it from a two-pronged approach. Obviously, Noel's a woman. I'm not. I'm a man. So my approach, and I have tons of friends like this, instead of, and you may relate to this as well, like, oh my God, a lot of guys, Susie, she's so hormonal, my wife, oh my God. And my approach is, don't approach it that way. Approach it more like, Susie, maybe you have hormonal imbalance. Maybe we should look into it. Instead of being like, what's wrong with you? I do this and that for you. And I think we're trying to change the dialogue, because men should be actively helping the women in their lives, because it's not just all the subjective issues, which are huge, which we'll touch on in a second. It's all the added additional health benefits for your heart and everything else we discussed. It is a worldwide epidemic, and women have been suffering in silence with this. And it's enough about this. It's 2025. We had a female vice president, whether you liked her or not, that's a different topic, but this is time. Like, is it enough about men? The women are the fairer sex and they should rule the world. And we're here to help them along their pathway.
Absolutely. I agree. The education and the awareness on especially the women's hormones needs to be there. We need to have more education. We need to have more awareness. And whether you're a man or you're a woman, like you said, for men, you have a mother, you have maybe a sister, you're going to have a spouse, or if you don't have a spouse, you have friends that are of the female sex. And for you to understand it more and even be their guidance if they're not aware of it is something that's crucial for a man. And on the women's side, it's your body. It's something that you're going to go through. It's something that I believe that you should start learning about and should start optimizing. So to that point, and Noel, I'll mainly ask you on this, a lot of people believe that do know about hormone replacement therapy is that it's mainly for older people. Once you've gotten to the point of menopause or gotten to the point of low testosterone or low estrogen, why is that a lie? And when should people start optimizing?
It's incorrect because previously the focus was on estrogen. And that is something I would see in my clients that would come in. They would say, I'm not in menopause yet, so there's nothing I can do. That perimenopausal space is actually the one that is most stressful for your body and everyone around you. You're essentially thrown back into puberty, where your hormones are like a wild wave. You don't know what you're going to get. Anyone with a teenage child is getting a check back and reminder to what it was like when you were a teenager yourself. Once you're in menopause or you've completed menopause, although you're a bit depleted and listless and feeling hollow, at least you're stable. You're not having the mood swings. You're not having the fatigue. You're not having all of those symptoms of that imbalance that you do later. Now, for the optimal supplementation for your body to really optimize all of the health benefits that Stu had mentioned of your bone density preservation, decreasing cardiovascular disease. Also, if you're thinking about it, even just from an aesthetic point of view, once you hit menopause, your first year, you lose 30% of your collagen in your skin. Right? Even in your hair too. The hair becomes very limp, brittle. If you want to prevent all of those things from happening, you need to start when you're in perimenopause and you supplement. So there's always that person, I'm not putting something foreign in my body. You're not. You're replacing what's already there, as Stu was mentioning about everyone adding in all these supplements. And I love supplements, but also let's focus on the building blocks of your body that's natural, because we are wonderful, right? All the advances in medicine, we're able to live longer, but we're outliving our ovaries. So this is a kind of newer problem because everyone's living longer. We also, as women, tend to be having children later. We may be needing to look into IVF. So then we're kind of screwing around with our hormones with that as well, supplementing so that we can get pregnant. We're getting pregnant later. So a lot of those women are going from pregnant to perimenopause right away. So that's a new phenomenon, and that's something that we can help with.
So the clinical data, the white papers clearly illustrate that you should start hormone supplements 10 years before menopause. Now, obviously, we use testosterone, estrogen, and progesterone, but it depends on, do you have a uterus? Did you have this? What are your levels? So we, unlike men, where men are very simple. Testosterone, testosterone. Women, it's a subtlety, and that's why you really need someone who's adept to knowing what you need and how you need it, how much you need. So as we're getting older, we're adding more estrogen to our clients. Everyone's taking testosterone. So it's a comprehensive assessment that we do. But the earlier you start, the data shows the long-term benefits of all those objective benefits Noelle just mentioned. But even when you start in menopause, it's not too late. No one should think, oh, too late. I missed the golden opportunity. There's always benefits, but the most benefits kind of start rolling in around 35. And that's what we kind of look at them and relay the data that they need. And they may not need everything. They may just need a little bit, a little refresh.
And we're definitely talking in the general sense. I've wanted to say this to so many of my friends, and you guys know this better than anyone. So I want to hear it all from you. I want all the audience to hear from you. How important is it to understand that every single person is different? There are going to be different effects, regardless if it's just hormone therapy or if it's any other the services that you guys do offer. How important is that?
I think, everyone's plan is completely individualized, not only for their levels, but we also do an extensive intake and questionnaire. Stu, I'm sure, will chip in on this. Sometimes it's not a number. You can have one person, let's use a man, for example. Their testosterone can be 600 and they feel amazing. We can have another guy that's at 900 and he says he still feels tired and so it is so completely individual. So the metrics are important, of course, they're important for safety, but it's also important to see how the person feels. And those numbers are completely individual. Even if we talk about GLP usage, one person's dose isn't the same as someone else's dose, and everyone loves to compare the numbers. I want to know what I'm on so I can tell my friend so she can be on it too, whether it's any kind of medication. And that is not it's not a one size fits all approach. In fact, it's quite the opposite.
Yeah, I mean, I think it's not one thing that we look for. So we look at their comprehensive history. So are they obese? Do they eat well? Do they exercise? Do they smoke? So all these little variables. Listen, hormones is a very important part of what we're talking about because that is your biology, but it's also looking at your lifestyle, your job, all these things play a role into what you're looking for and what we can do to help you achieve your goals. It's not what our goals. We're merely shepherds on your path to better health. And, one of the other things we look at in our patients, which is different from a lot of other services, is we also look at your DNA. We can do DNA hormone testing. So we look at your DNA, we look at the hormone pathway, the steroid pathway to producing your hormones. So it's a very particular pathway. We're not looking at all your DNA because that becomes overwhelming. If all of a sudden I told you had to change 50 things, you're going to go, forget it. That's too much.
I won't do anything.
So we're focusing on DNA hormones, and we can't change your DNA. So it's a one-time test because you never need to repeat it because you can't change your DNA because that's what you were given. But what we look at is the pathway to steroidogenesis and what those defects might be in the production of your particular issues with testosterone, progesterone, DHE, cortisol. And then we get a beautiful, it's very easily written. So you can read it, you can understand it, but we will digest it with you. And then Noelle and myself will say, that's great that you're taking these 20 supplements, but that's too many. By looking at your DNA, we can take these and go like this. These, for what we're looking at particularly, not everything, these are the 3 that we find optimized for you because this is your defects, your DNA. So we're able to customize it even further for our clients. And it's also a nice additive for the hormones, but also because there is some negative connotation with hormone replacement from bad publications in the past, it allows some of our female clients who are like, you know what, I don't know, I want to dip the toe into the hormone bag yet, but the DNA stuff, let me do that. And then at least it starts the conversation about the hormones. The hormones always are really, really crucial, but at least it gets them talking about it, moving forward, and gives you the trust that they have in what we're doing. And that's really important when you're taking care of another person, building that trust. We're not here to tell you and make you do anything. We're here just to give you the knowledge. So you, with the both of us, we can pick the path that you want. You want to do the hormones and the DNA? It's a home run. You want to dip the toe in the DNA hormone first and take the nutraceuticals first before the hormones? We're cool with that too. So that's something also really unique that we're able to offer our clients.
And I just wanted to make that clear for everyone, because there is such a big, powerful stance on word of mouth, and a lot of people going, oh, well, I do this and you should do the same. And which one do you do? I'll just do that one. And we're talking about our bodies here. And we might all think that we're similar, but we're not. And I just wanted to make sure that we're hearing it from other people. So for everyone out there,
people wanting to copy someone else's treatment plan is the person who's heard something negative so that they want to copy doing nothing.
Yeah.
And that is the worst, because there's so many different options, as Stu said, that are individualized for the patients that can really help them. A lot of these women, I keep saying women, we do it for both, but they will feel awful. Their marriages suffer. There's a reason that it's the highest divorce rates is when you're in perimenopause. There's nothing magical. I used to think when I was younger, I'm like, everyone gets divorced around when they've been married 15 years. I wonder what's up with that, because that's when you're in perimenopause and you hate everyone around you. And it's very contagious. So not only are we able to help these women, but help them in an effective way to really light them up. I see with our patients sometimes, they'll come in, even people that if they've seen another one of our team members and they haven't seen me, and someone will walk in, I'll be like, oh my God, Sarah, you look incredible. What did we do for you? She's like, hormones. It happens all the time. It really brings life back into them and helps everyone around them. So if they're not being presented with this information and then they go to an uneducated provider who will a lot of times give them an antidepressant, which then ends up creating weight gain, low libido, and many other things, which then makes them more depressed. And it's just a really vicious spiral.
Yeah, I had a patient in my regular urology world, a female I checked her hormones very low. So I supplemented like we do. And her husband's my patient. His testosterone was about 500. So the normal range for men is 250 to about 900. He literally was like, and he felt great already. He's like, I can't keep up with her. I literally need more testosterone because she's
it's a good problem to have.
Focused, energetic, more sexually active. So I actually treated him, which I do for men in that level anyway. And, even now he's like, I need even more. I can't get it. So it's a win-win situation. One quick note I wanted to mention, which is a big thing that we have issues expressing to our clients, is most medical students in OBGYNs get less than 3 hours of menopause training. So a lot of our clients will say, oh, I had my labs tested already. They're normal. The problem is these physicians don't know what normal is.
Well, it is normal for someone to be aging and for it to be declining. That's normal, but it doesn't mean that you can't be optimized and supplemented to be back where you were when you were younger.
Because don't forget, the same thing's happening with men, but they can take all the supplements they want because it's okay. That's the kind of world we're living in. We're just trying to let women know that your levels may have been told that they're normal, but they're not normal because, it's not a normal process to lose your hormones in menopause. I mean, it is a normal process, but we could supplement that through your whole process and give you all these added benefits and not have to go through what your grandmother who was, 100 years ago was told was normal.
It's normal to have gray hair. People color it. Yep. No one thinks about that.
Well said.
It's so much information about the hormone therapy world, the hormone replacement therapy world has, unfortunately, I would say, undiscovered or not utilized in today's society, which I'm glad to have this conversation with you guys. And I know there's so many different services that you guys offer that you can talk about as well. So we definitely need to have another podcast and talk on different topics as well. But if we were to stay more on the hormone topic, what does the future look like? What piece is nobody talking about right now that will become more obvious?
For me, if we're talking about the closer to the in the next few years, one of the messages I personally want to get out, because I do a lot of work with GLPs. I'm on a GLP, even if we're microdosing for longevity and reduce inflammation, if we're looking at it for brain health, if we're looking at it for all the different benefits of the GLP, the integration of the hormone therapy with that is a complete game changer. So not only is it giving you the building blocks for preserving the lean body mass that unfortunately does end up diminishing, even if you're eating all your protein and you're lifting, which are great. You have to do that too. If you don't have the hormones to put that signal in for your body to keep building your muscle and maintaining it, your lean body mass is going to atrophy, and lean body mass is the number one indicator for longevity. So for me, I feel that everyone that could possibly qualify for hormone optimization and wants to go on a GLP needs to do the two things together. For that reason, number one, and then again, because we do own a medical spa, if we're talking about the skin integrity, we need those building blocks for your collagen and elastin, so that you don't have the dreaded GLP-1 face with the sunken in cheeks, and then also your skin itself. It's not as springy and youthful looking. So as you're doing all these things to help yourself from a longevity place, you're at a healthy weight, you're doing the hormones, you want your body to reflect it as well. And, your skin is not just a canvas, but a biomarker, and you can see how healthy the person is by even just looking at their skin. So I think both things need to be done together.
I would say hopefully the conversation that we're having today, we won't need to have in 5 years, where everyone's just women. It's commonplace that women are on hormones. We use what's called bioidentical hormones, and there's a lot of hormones out there. So that's literally the almost genetic duplicate of what the kind of testosterone and estrogen and progesterone the body makes. So we're trying to mimic. We're not just making some other similar compound in a lab, and we offer many different ways of taking it. So the other thing that is on the precipice, so there's a lot more conversation going on about menopause and hormones. We're in the infancy. There's a lot of new data coming out showing the effectiveness of it. But one thing we didn't talk about today is the other big thing currently going on is to talk about longevity, right? There's a lot of new information coming out about longevity. I don't just mean longevity about just living longer and a healthier lifespan, right? No one wants to live long if they're not healthy, right? Everyone wants to live a longer life, but also a healthy life, which is your sex span is increased, your lifespan is increased, your health, your quality of life is increased. So there's a lot of good data out about hormones, particularly. There was a good paper looking at women who were on already a hormone replacement who were going into menopause for about 10 years, and those women that were not, and they looked at their telomeres. So when we talk about longevity, there's a lot of information about what is the best predictive test. There's mitochondria activity, there's cell senescence, there's all kinds of things. But and it's like a pyramid. At the bottom, one of the most important things is your telomeres. And what the telomeres are, if you remember from your DNA, Watson-Crick, the halo of the DNA, on the ends are these protein pillars, which are called telomeres, and they have a protein cap. As we get older from life, getting older, smoking, eating, the telomeres start shrinking. And you can do a test today, which I'm sure you're familiar with, where you can look at your telomeres, and let's say you're 50, and then you'll get your biological age, which is reflective of the telomeres and other things. And hopefully your biology age, let's say you're chronologically 50, is 47. And then you can work on things to lower that. You can actually repeat your telomeres, unlike the DNA test we mentioned a few moments ago, which you just do it one time. So what we're doing also at Equilux is we're taking it to that level. We're offering a telomere test, which is going to look at your chronological age, biological age. Hormones have been shown to hasten the shortening of that, if not anything, maybe increase it. So in that study I mentioned earlier, they looked at the telomeres, and those women taking hormone replacement, their telomeres were stabilized, while those that did not, those continued to shrink. It doesn't prevent you from ever, dying, but it's one of many factors along with diet and exercise. So it's a comprehensive thing, but you wouldn't want to leave out one of the most important things, which is, your biology. Let's jump back inside that box for a minute. So I think that will be proven to showing more and more effectiveness for increasing longevity. And that's another tool that we've brought into our tool shed to, again, we're not just treating hormones, we're treating their DNA. We're looking at how this impacts their longevity, health span, sex span, and quality of life. So I think that conversation is started, but hopefully 5 years from now, we won't be at the finish line, but hopefully we'll be having a conversation, the three of us, about Wow. Do you remember 5 years ago we talked about hormones? We don't need to talk about it today. Everyone's doing it. What is Equilux doing now?
There's so many topics that I want to talk about right now, and we have to do another podcast soon. And we'll say another sneak peek. The next one will be about longevity.
Perfect.
And there's so much more that I know I need to learn, as well as everyone watching this right now that needs to learn, understand. And I know everything that we spoke about beforehand for everyone out there might seem very complex. I'm going to ask them in a second. Don't you worry. We will have information where you can read it on yourself and you can reach out and learn a little bit more from either myself or Stuart or Noel. But the last question that I have for you guys before we wrap this completely up is, what is one, and I'm going to say, Noelle, I'm going to start with you first, and then Stuart, you're going to answer right after her. What is one piece of wisdom, whether from a mentor, a patient, or your own life, that has truly reset the way that you think about health and longevity?
One of my patients one day said to me, she was talking about aesthetics. So she was talking about she needed to schedule her appointment for her laser and her Botox and whatnot. And I said, okay, yeah, absolutely. We'll get you scheduled. And she was being funny, but she's like, honey, we're old for longer than we're young, and I'm going down fighting. And I thought that was so brilliant because it's true, right? What do we consider young? Under 25, the most of your life is when you are middle-aged and older. It's what you really need to invest in. That's the prime of your life. And that by doing the nutrition and the hormones and maybe the aesthetics, if you're into that too, that's what keeps you living a long time and living well.
Yeah, I mean, I would say this is the greatest invention that's ever been created, even more important than TikTok and your iPhones. And you got to take really good care of it. And I think, as we were talking a few minutes ago, we're on the precipice of really breaking through some of these DNA defects and some of these we really will have. Right now we're talking about functional medicine, where the treatment for X, Y, and Z for me is going to be much different than what it is for Noel, because we're going to look at your DNA and say, you know what, this treatment for Noel's DNA, that's not good for you, Stu. We need this. So we're really getting down to really like microcosms of optimizing treatments, which I think is going to be incredible. And then we're taking that piece in really going to prove and improve the quality of people's lives and longevity. And then I think one of the more important thing is just, I can speak on this personally, is just having a partner who is passionate about what you do. We are passionate to a fault, maybe sometimes, about what we do every day. I get up every morning. I mean, I see people every day who are like, oh my God, you're working. I love what we do. We were not looking for this. Our lives were very busy with NDA, the medical spa, and my urology stuff. We just felt this was an opportunity where we could really educate others on what we've been learning and really pass this wisdom on to others, because there are so many people suffering who don't have this knowledge. So it's all these different kind of things that kind of translate into all the things that you're talking about. But you really got to take care of this. And there's so much misinformation on Instagram, on TikTok about what you should be doing and what you shouldn't be doing. Always look for a certified physician. Always look for someone who doesn't seem like they're selling you snake oil, because you got to be careful what you put in your body, and you have to be careful about who's telling you what you should be doing. So researching, which is what we do on our website, if you may have seen, we have research articles. We're not just promising you long life to live 200 years, but there's a lot of good information out there. It's just weeding through the mess to get to the cores. And we're hoping at Equilux and NDA that we can help you on your path to better health, understanding, knowledge, and longevity.
So all in all, where can people find more information for the time being before we do our next podcast? Where can people find more information?
Well, we put a lot of information out there because, as you can tell, we're very passionate about it. So you can follow us on Instagram. So either NDA Med Spa is the handle for the NDA, or Unlock Your Biology for Equilux. And then my personal one is Noel Diamond Aesthetics. And then his personal one is Dr. Stuart Diamond. We're on LinkedIn. We have our websites, ndamedicalspa.com and unlockyourbiology.com. And we're also on YouTube with the same handles.
That was a mouthful.
Well, I will have all those links in the description down below for everyone else to check out. Please check them out. Ask questions. Put all of your questions down below in the comments as well. The next topic we'll talk about is longevity. We might touch a little bit on the business aspects, starting NDA, starting Equilux as well.
Sure.
It's phenomenal what you guys are doing, a true power couple and
Thank
true
you.
entrepreneurs to see out in the world that are hyper passionate. I love it. I love to see it.